Hello everyone! Good day! My name is Erich Catig, a caregiving student of St. Augustine School of Nursing, Quezon City. For today's video presentation or demo presentation, we'll be doing the NGT or Nasogastric Tubing. So inserting a nasogastric tube, this is a method of introducing a tube through nose into stomach. By inserting a nasogastric tube, you are gaining access to the stomach and its contents. This enables you to drain gastric contents, decompress the stomach, obtain a specimen of the gastric contents, or introduce a passage into the GI tract, and this will allow you to treat gastric immobility and bowel obstruction. The purpose of this is to feed client with fluids when oral intake is not possible, to dilute and remove consumed poison, to instill ice-cold solution to control gastric bleeding, to prevent stress on operated site by decompressing stomach of secretions and gas, and to relieve vomiting and distension. Materials needed are the following: the nasogastric tube in appropriate size, this one. We also have the syringe, the lubricant, cotton balls here, kidney tray, adhesive tape, stethoscope, the clamp, marker pen, steel tray, and disposable gloves if available. So first, you have to check the doctor's order for insertion of nasogastric tube. This clarifies the procedure and type of the equipment required. Then explain the procedure to the client. Explanation facilitates client cooperation. Hello sir, good morning. My name is Erich and I'll be your caregiver. And we'll be doing the insertion of the gastric tube on your nose so that we can feed you properly, because we know that you have a difficulty in eating solid food. Okay? So then, we have to gather the equipments because organization provides accurate scale performance. So, your name again, sir? Andrea, and your birthday? Okay, thank you. Assess client's abdomen. By assessment, it will determine the presence of bowel sounds and amount of abdominal distension. So we'll be checking by using this stethoscope. Perform hand hygiene. Wearing disposable gloves is necessary or if available. This is to prevent from spread of microorganisms, but sterile technique is not needed because the digestive tract is not sterile. So we have also to assess the client to high Fowler's position or 45 degrees. If unable to maintain upright position, more natural for swallowing. Sir, okay? I'll be positioning you. Let's adjust your body. Help yourself. Move. More. Then check the nostrils. The tube passes more easily through the nostril with the largest opening. So we have to check by checking the nares. For patency, by asking the client to occlude one nostril and breathe normally through the other. So have to check, sir. Inhale on your nose. Exhale. Inhale. Exhale. Then clean the nares by using cotton balls. So I'll be cleaning. And we have to select the nostrils through which air passes more easily. So we'll be doing the left side. Okay? Measure the distance to insert the tube by placing the tip of the tube of client's nostril And then extending to the tip of the airlobe. And mark tube with marker pen or piece of tape. Okay, measurement ensures that the tube will be long enough to enter the client's stomach. Then lubricate the tip of the tube at least 1.5 inches with a water-soluble lubricant. This will reduce the friction and facilitates passage of the tube into the stomach. Xylocaine jelly may not be recommended to use as lubricant due to the risk of xylocaine shock. Water-soluble lubricant will not cause pneumonia if tube accidentally enters the lungs. So insert the tube into the nostril by directing the tube downward and backward. The client may gag when the tube reaches the pharynx. So instruct the client to touch his chin to his chest. Sir, you can put your chin down to your chest. Your chin. And then encourage her to swallow even if no fluids are permitted. Then advance the tube into downward and backward direction when the client swallows. Stop when the client breathes. If gagging and coughing persists, check placement of the tube with a tongue depressor and flashlight if necessary. Keep advancing the tube until the marking of the tape is reached. Following the normal contour of the nasal passage while inserting the tube reduces irritation and the likelihood of mucosal injury. The gag reflex stimulated by the tube and swallowing helps advance the tube causes the epiglottis to cover the opening of the trachea and helps to eliminate gagging and coughing. Excessive coughing and gagging may occur if the tube is curled in the back throat. Forcing the tube may injure mucous membranes. The tube is not in the esophagus if the client shows signs of distress and is unable to speak or hum. Okay, so can you hum? While keeping one hand on the tube, verify the tube's placement in the stomach. Aspiration of a small amount of stomach content. Attach the syringe to the end of the tube and aspirate small amount. Okay, when you attach the syringe to the end of the tube and aspirate small amount of stomach contents, visualize aspirated contents for colors and consistency. For auscultation, inject a small amount of air, 10 to 15 ml into a nasogastric tube. While you listen with the stethoscope approximately 3 inches or 8 cm below sternum to obtain a geograph of placement of tube as ordered by doctor. Tube is in the stomach if its contents can be aspirated. And also, you'll be able to hear the air entering a wheezing sound if the tube is in the esophagus. Injecting will be difficult and impossible. Secure the tube with tape to the client's nose. Be careful not to pull the tube too tight against the nose. Constant pressure of the tube against the skin and mucous membranes causes tissue injury. Then clamp the end of the nasal tube while you bend the tube by fingers into the open bending tube prevents the inducing of secretion. Put off and dispose gloves, perform hand hygiene. Then put off and dispose the gloves, then perform hand hygiene to prevent the spread of infection. Okay, then replace and properly dispose of equipment to prepare for the next procedure. Record the date and time, the size of the nasal gastric tube, the amount and color of drainage aspirated, and relevant to client's reaction. Then sign the chart. Report to the senior staff to provide continuity of the care. So in continuation of this video, we will be administering a nasal gastric tube feeding. A nasal gastric tube feeding is a means of providing liquid nourishment through a tube into the intestinal tract when client is unable to take food or any nutrients orally. The purpose of this procedure is to provide adequate nutrition, to give large amount of fluid for therapeutic purposes, to provide alternative manner to some specific clients who have potential for acquired swallowing difficulties. So the materials needed are the following: the disposable gloves. We also have the feeding solution as prescribed. We can use also the feeding bag. This is the syringe. This is a 60 ml, and this is the asepto syringe. Okay, we also have water in the jug, then measuring cup if needed or if available, then clamp, we do have clamp, paper towel as required, doctor's prescription, and stethoscope. So first, we have to assemble all equipments and supplies after checking the doctor's prescription for tube feeding. This is to facilitate accurate skill performance. Checking the prescription confirms the type of feeding solution, route, and prescribed delivery time. Next, we have to prepare the formula. If in can, check expiration. If powder, mix according to instruction. And if liquid, make formula at a time and allow formula to reach room temperature before using. So we have to explain the procedure to the client. This is to foster client's cooperation and understanding. Okay, sir. My name is Erich again. We'll be doing the tube feeding now. So since you cannot swallow food in your mouth, we'll be using this to feed you the liquid through your nose. Okay, so your name again is ANDREI, and you are. We will be continuing the procedure after we did the insertion of the tube. Okay, so we also have to perform hand hygiene and put on disposable gloves if applicable. We already positioned the client with the head on the bed elevated at least 30 to 45 degrees angle. Then determine the placement of the feeding tube by aspiration of the stomach secretion. So we have to aspirate the stomach secretion. Then injecting 10 to 20 millimeter of air tube. Then taking an X-ray or ultrasound may needed to determine the tube placement if needed or if possible. So for intermittent or bolus feeding, if we're gonna use a feeding bag, so we have to insert the tube here and then we just hang the feeding bag. Then hang the feeding bag at least set up to 12 to 18 inches above the stomach clamp. Then clamp the tubing. Fill the bag with prescribed formula and prepare the tubing by opening the clamp. So we have to clamp the tubing. And then attach the end of the setup to the gastric tube. Then add 30 to 60 millimeter of water to the feeding bag as feeding complete. Then clamp the tube. So, like this one, we'll remove the clamp. And then we will put the feeding formula and squeeze slowly. Have to relax her because the food liquid is going to inside your stomach. Okay, are you feeling okay? Then after finishing the feeding or the insertion of the formula, we have to clamp the tube. Feeding the following. So we have to clamp the tube, insert the tip of the large syringe with plunger or valve, then remove into the gastric tube. Then pour the feeding into the syringe. Then raise the syringe 12 to 18 inches above the stomach. Then open the clamp. And allow the feeding flow slowly into the stomach. Raise and lower the syringe to control the rate of the flow. Then add additional if needed. So this is how we do it. So after raise, then push. Okay, until it is complete. So for termination of the feeding, we have to terminate the feeding when complete, then instill prescribed amount of water. And keep the client's head elevated for 20 to 30 minutes. So every time, you have to clamp so that there will be no discharge. Then put water. Then we will do mouth care. Then we will provide mouth care by brushing the teeth. Okay, then offer mouthwash and keep lips moist. Then clean and replace the equipment to proper place to prevent contamination of equipment and prepare for the next procedure. Then remove gloves and perform hand hygiene to prevent spread of infection. Then we have to document the date, time, amount of residual, amount of feeding, and client's reaction to feeding, and sign the chart. Documentation provides continuity of care. Giving signature maintains professional accountability. As continuation of this video, we will now be doing the removal of the nasal gastric tube. First, we have to assemble the appropriate equipment such as kidney tray, tissue or gauze, and disposable gloves at the client's bedside. Explain to the client what you're going to do. This is to foster cooperation. Sir, we're done with feeding you. Now we will be removing the tube. Okay? So that you can relax and be comfortable without the tube on your nose. Okay? So we have to put on the gloves. This is to prevent the spread of infection. Okay, then we will remove the tube. Take out the adhesive tape which holding the nasal gastric tube to the client's nose. Remove the tube by deflating any balloons. Simply pulling out slowly at first and then rapidly when clients begin to cough. Then conceal the tube. Be sure to remove any tapes from the client's face. Acetone may be necessary. So feeling better, sir? You're good? You're full? So you have to take note. Do not remove the tube if you encounter any resistance, not to harm any membranes or organs. Do not do another attempt in an hour. Continue slow pulling it out can lead to coughing or discomfort. So I'll be repeating the procedure. So if the tube is attached, so it's inside the nose, you have to slowly remove the tape. Then slowly pull the tube. Then if the client cough, okay, then rapidly remove the tube. Okay. Continuous slow pulling it out can lead to coughing or discomfort. That's why when the patient or the client cough, you have to rapidly remove the tube right away. When you check the face of our client, make sure that there is no tape or any residue of the tape on the skin. So if there is any, acetone can help for any adhesive substance from the face. You should also wipe acetone out after removing tape because it can cause skin irritation. Then we also have to provide mouth care if needed for the comfort. So we already did that after we feed the client. Okay, so we just have to put off our gloves and perform hand hygiene to prevent spread of infections. Then we will now record the date, time, and the client's condition on the chart and be alert for complaints of discomfort. Distension or nausea will be experienced after removal. So you have to check that after you remove the tube. Then sign the chart to provide continuity of the care and maintains professional accountability. Then dispose all the equipments and replace them to prepare for the next procedure. Then you have to report to the senior staff to provide continuity of the care. And since we already did the documentation, then the amount of the residual and the amount of feeding and the client's reaction to the feeding, and we already did sign the chart. So documentation provides continuity of the care and giving signature maintains professional accountability. Alright, that's it guys. We already did the insertion of the tubing. Then we feed our client through nasal tubing, and we did also the removal of the tube. So thank you so much, sir, for cooperating with me during this procedure. I hope you'll feel better and you are full now. And then I will put you now, sir, on a comfortable position. Okay, sir. Slowly. Slide your body. And then our client is now fully fed and comfortable. Sir, thank you so much for today. We will go back tomorrow to do the procedure again. Alright guys, thank you so much for watching. I hope you learned something from this video. And just continue to watch our upcoming videos and the posted videos in this channel for you to learn how to do the caregiving for our clients. Thank you again so much for watching and have a great day. Bye guys!